What really happens to your prostate after 50? The answer might surprise you, but it could also be the gentle warning you need to hear right now. I invite you to pause for a few minutes, as if you were stepping into a private consultation room where there's no noise, no rush, only full attention given to your health. Maybe you don't feel anything unusual. Maybe everything still seems fine. But sometimes it's the quietest changes that deserve the most attention, especially when it comes to the prostate, a small organ that plays a big role in men's health after the age of 50. You may have thought that waking up at night to urinate, the feeling of not fully emptying your bladder, or unexplained fatigue were just normal parts of aging. But today I want to offer you a different perspective, clearer, more proactive, and filled with hope. Because with the right understanding and early awareness, you can take control of your health instead of letting age dictate it. I've worked with many patients over 60, people just like you, who once silently endured these symptoms, but later found relief, confidence, and control simply by starting with awareness. And I believe the same can happen for you. If you've ever asked yourself, what's happening to my prostate after 50? Leave a comment saying, I want to know the truth about the prostate after 50. It's not just a way to mark the beginning of your journey, but also a way to encourage others your age to take their health more seriously. If you find this topic valuable, feel free to like this video and subscribe to the channel so you don't miss the in-depth discussions coming up. And now let's explore the little-known truths about the prostate, truths that can deeply impact your quality of life after 50. 1. Lifestyle and prostate health science has repeatedly confirmed that our daily habits, though seemingly small, have a profound impact on prostate health, especially after the age of 50. Maintaining a healthy lifestyle not only helps prevent bothersome symptoms like nighttime urination or incomplete emptying of the bladder, but also lowers the risk of developing serious conditions such as prostate cancer. One of the most powerful factors is physical activity. Studies have shown that brisk walking for just 1 to 3 hours per week can significantly reduce the risk of developing advanced prostate cancer. Regular movement not only helps manage weight, but also supports hormone balance and improves blood circulation to the pelvic organs, including the prostate. Alongside exercise, nutrition plays a key role. A diet rich in vegetables, fruits, whole grains, and lean protein provides natural anti-inflammatory nutrients that help reduce abnormal cell growth in the prostate. Cruciferous vegetables like broccoli, kale, and bok choy, along with ripe tomatoes rich in lycopene, have been shown to help prevent tumor formation. On the other hand, frequent consumption of foods high in saturated fats, such as processed red meats, whole milk, or fried and grilled items, increases inflammation in the body, worsening prostate-related issues. Sleep and mental health are equally important. Quality sleep helps regulate the immune system, control hormones, and reduce unnecessary stimulation of the prostate. Chronic stress or insomnia has been directly linked to an increased risk of prostate enlargement and more frequent nighttime urination. Maintaining a regular sleep schedule and practicing gentle relaxation techniques, such as meditation, deep breathing, or warm baths, can bring significant benefits for older men. And finally, something that seems simple but is often overlooked: drinking enough water. Proper hydration keeps the urinary system functioning well and helps prevent urinary tract infections, a common trigger for prostate irritation. However, men should avoid drinking too much water in the evening to prevent sleep disruption from nighttime urination. In summary, a healthy lifestyle not only protects the prostate, but also lays the foundation for a stronger, more proactive aging process. By adjusting your diet, increasing physical activity, getting enough sleep, and managing stress, you're building a solid base for long-term wellness. This isn't just advice. It's backed by numerous international studies, offering real hope for millions entering their golden years. 2. Early detection through regular screening. As we enter middle age and later years, taking care of the prostate shouldn't stop at a healthy lifestyle. It needs to go further with regular screenings. Early detection is the most reliable first line of defense to stop potential risks before they begin. Most importantly, early detection doesn't just allow for timely treatment, it helps you live with more confidence and peace of mind every day. Large-scale studies have shown that men over 50 who undergo regular prostate screenings have a significantly lower risk of dying from cancer compared to those who don't get checked regularly. The long-term benefits are even clearer, not only saving lives but also greatly reducing the need for complicated medical interventions later on. Specialists say that catching prostate cancer in its early stages often means better disease control, with fewer needs for chemotherapy, radiation, or complete surgical removal. In current clinical practice, the two most common screening methods are the PSA blood test and digital rectal examination, DRE. PSA, short for prostate-specific antigen, is a protein produced by the prostate. When PSA levels in the blood are abnormally high, it may signal inflammation, enlargement, or even cancer. The higher the number, the greater the risk. Even in the absence of symptoms, PSA testing can detect early changes, giving doctors a chance to intervene early and monitor closely. The digital rectal exam, DRE, performed by hand, is a complementary tool that helps doctors detect changes in the size, shape, or texture of the prostate. While not as effective on its own as PSA, combining both methods increases the accuracy of detection. This is especially important for men with a family history of prostate issues or those in high-risk groups. Both tests should be seriously considered in these cases. However, it's important to note that not everyone needs to screen the same way. Medical associations recommend that men aged 55 to 69 talk to their doctor about the benefits and risks of PSA testing and tailor a plan that suits them best. For those over 70, whether to screen should be a more nuanced decision, taking into account overall health and life expectancy. This thoughtful approach helps avoid overdiagnosis and overtreatment while preserving comfort and dignity in older age. Early detection isn't just a medical strategy, it's a way of showing responsibility for yourself and your loved ones. When you choose to get screened, even if it's just a simple blood test, you're sending a clear message: I value my health. That's also the moment when vague worry turns into meaningful action, giving you greater control and peace of mind about the future. Have you ever had a PSA test, or are you planning to take one soon? Leave a comment. I'm ready to screen for better health after 50, as a reminder to yourself and as inspiration for others to take action. Taking care of your prostate is an important part of taking care of yourself, and that journey begins with your choice to act today. 3. Hormonal changes in prostate function. Once we understand the importance of regular screening, the next thing you need to grasp is a topic that's rarely discussed, but has a profound impact on prostate health, especially after 50. It's about hormonal shifts, seemingly minor changes that greatly affect the function and condition of the prostate. Science has confirmed that as men enter middle age, they experience a process known as age-related testosterone decline. Testosterone, the primary hormone responsible for vitality, stamina, and the normal function of the prostate, begins to decrease gradually. A 10-year longitudinal study showed that men over 50 lose about 1 to 2% of their natural testosterone levels each year. This drop doesn't just impact sleep quality and mood, it directly weakens the body's ability to regulate cell growth within the prostate, making the gland more vulnerable to dysfunction. Along with this testosterone decline, the body begins to adjust its supporting hormones. Estrogen, a hormone more commonly associated with women, also starts to play a greater role. While the estrogen levels in men over 50 are nowhere near those in women, even a slight shift in the testosterone to estrogen ratio can stimulate prostate tissue, leading to benign prostatic hyperplasia, BPH, or a mild sensation of pressure in the pelvic area. An international medical report highlighted that 40 to 50% of men over 60 experience symptoms like difficulty urinating or frequent nighttime urination, primarily due to the prostate reacting to this hormonal imbalance. These hormonal fluctuations aren't just about quantity. They reflect the fact that the body's endocrine regulation is no longer running as smoothly as before. Many assume that feeling like you haven't fully emptied your bladder, having a weak stream, or a persistent warm or tense feeling near the bladder is just part of aging. But it's not. These are often the clearest signs that the prostate is being affected by internal hormonal changes. And this isn't something to be passively accepted as inevitable. It's your body signaling that it's time to restore balance. So what can we do? The first step is to understand and acknowledge these hormonal changes. Once you grasp how testosterone declines and estrogen rises, you can take proactive steps to support your body. Engage in light daily exercise, choose antioxidant-rich and hormone-balancing foods, get enough sleep, and avoid chronic stress. These are the foundations that help the prostate function more smoothly and reduce unnecessary stimulation of its tissue. Several studies have shown that men who adopt a balanced lifestyle with proper nutrition, consistent physical activity, and adequate rest can significantly reduce symptoms like nighttime urination or difficulty voiding, even as hormone levels begin to decline. This is powerful proof that even if hormones change, you still have control. You can improve your condition and even slow down how age affects your prostate. Have you noticed any subtle changes in your body after turning 50? Maybe it's lighter sleep, more frequent urination, or just a lingering discomfort in the lower abdomen. Share a short message like, "I've noticed changes in my prostate since turning 50," or "I want to learn how to balance my hormones for a healthier prostate." Let's make these experiences visible to the community and inspire each other to take action for long-term health. Because understanding your hormones is the key to a stronger, more fulfilling older age. 4. Increased risk of prostate enlargement. Prostate enlargement doesn't discriminate. It can quietly affect any man, regardless of how healthy he may be, simply because of age. Global studies consistently show that the older a man gets, the more likely his prostate is to enlarge, and the more frequent urinary symptoms tend to become. It's no coincidence that BPH, benign prostatic hyperplasia, is considered one of the most common urological issues among middle-aged and older men. One key reason BPH becomes complicated is that many men accept it without questioning the cause. Some believe that waking up a few times each night to urinate is just part of getting older. But if this happens every night, disrupts your sleep, and leaves you feeling drained during the day, it's clearly not something to ignore. It directly affects your quality of life, productivity, and even mood, memory, and heart health due to chronic sleep loss. What many don't realize is that BPH isn't just about urinary discomfort. When the prostate enlarges and consistently blocks urine flow, it creates back pressure on the bladder. Over time, this can make the bladder more sensitive, more easily irritated, and harder to control. The result? Sudden urges to urinate that may be difficult to hold in, causing emotional stress and a loss of confidence, especially in social settings or while traveling. If BPH isn't properly managed, it can lead to more serious complications such as bladder stones, recurrent urinary tract infections, or even kidney damage caused by long-standing urine retention. What's concerning is that many of these complications develop silently, with no pain or obvious signs until it's too late. That's why early awareness and intervention are so critically important. It's also important to note that the severity of BPH doesn't always match the size of the prostate. Some men may have a large prostate with few symptoms, while others with only a slightly enlarged gland may experience significant discomfort. That's why you can't rely solely on how you feel. Accurate diagnosis requires proper testing, such as ultrasound imaging, urine flow measurements, and post-void residual volume assessment. From this perspective, being proactive, listening to your body and seeking medical advice when something feels off is the smartest choice. Rather than waiting for complications to develop, you can opt for a gentler solution, one that saves time, money, and preserves your everyday comfort. Many men have fully managed their symptoms through lifestyle changes combined with medical guidance, without needing medication or surgery. Don't let silent discomfort steal your sleep, peace of mind, and daily optimism. If you've ever felt like you didn't fully empty your bladder, noticed a weak urine stream, or found yourself needing to go again just after finishing, consider it a vital message from your body. Choose a proactive, informed lifestyle, starting with learning, sharing, and taking action. And if you want to help spread that proactive mindset in our community, leave a comment like, "I choose to take charge of my prostate health," or "Quality of life starts with the right awareness." It's not just a declaration for yourself, it's a source of encouragement for many others who may be quietly facing the same challenges. The prostate's crucial role in overall health. After understanding the factors that impact the prostate, such as hormones, lifestyle habits, and the risk of enlargement, the final and most important point is recognizing the full role the prostate plays in a man's overall health. It's not just an isolated organ, it's a central part of your health network, influencing your physical strength, mental well-being, daily function, and overall quality of life. The prostate, though only the size of a walnut, sits in a strategic position just below the bladder and surrounds the urethra, the tube that carries urine. It plays an active role in semen production and urine control. But beyond that, medical experts have highlighted that a healthy prostate supports hormonal balance, especially testosterone, helping stabilize mood, preserve muscle mass, support bone strength, and maintain efficient metabolism. On the flip side, when the prostate becomes inflamed, enlarged, or functionally imbalanced, the effects extend far beyond urination or sexual health. They ripple into emotional well-being, chronic fatigue, disrupted sleep from nighttime urination, reduced libido, and, in many cases, increased risk of anxiety and depression. This explains why many men, though not suffering from a major disease, can experience serious disruptions in life simply due to a poorly managed prostate. Just as the heart pumps blood and the lungs manage breathing, the prostate regulates a large portion of male physiology. When it functions well, men often feel energetic, in control of their bodies, and physically grounded. But when the prostate is off balance, everything seems to shift. They wake up multiple times at night to urinate, avoid social interactions for fear of sudden urges, and even pull away from intimacy, an essential part of family happiness. That's why caring for your prostate isn't just an older man's issue or a minor medical concern. It's a comprehensive health strategy, a foundational step in maintaining proactive wellness after 50. Regular checkups aren't just about detecting illness. They're a way to claim control over your body. Eating wisely, exercising properly, and resting well aren't just about being healthier. They help your prostate, hormones, and immune system operate at their best. Long-term health studies show that men who maintain a healthy prostate through positive lifestyle habits enjoy up to 30% higher levels of energy and activity compared to those with prostate issues. They're also less likely to experience complications like erectile dysfunction, chronic nighttime urination, or persistent fatigue. For all these reasons, prostate care should be viewed not as a personal burden, but as an investment in your physical strength, mental clarity, and full presence in daily life. Because when you're healthy, you don't just live longer, you live better. You live with joy, confidence, and purpose. And if you've experienced a peaceful day without sudden urges or enjoyed a full night's sleep thanks to a well-functioning prostate, share your experience in the comments with a phrase like, "I believe a healthy prostate is the key to living well every day," or "I choose to care for my prostate to stay strong after 50. Your words could be the inspiration someone else needs to take that first step toward lasting health. Dear friend, if you've stayed with us until this very moment, I believe you now have a clearer, deeper understanding of the prostate's role in men's health after age 50. The information in today's video isn't just medical knowledge. It's practical guidance to help you take charge of your well-being, from recognizing subtle changes to making the right lifestyle adjustments and caring for your body properly. Together, we've covered the essential topics: the importance of hormonal balance, the risks of prostate enlargement, the power of healthy habits, the value of regular screening, and how the prostate affects both your physical and mental health. But most importantly, the key takeaway is this: health isn't about luck. It starts with the smart choices you make every day. Whether you're just beginning to learn, are already experiencing symptoms, or simply want to maintain your strength, leave a comment to encourage yourself and others. I choose to live healthy every day, starting with my prostate. We truly appreciate every share and will do our best to respond to questions that matter to the community. And remember, the information in this video is for educational and reference purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor to make the best decisions for your individual health situation. If you found this video helpful, don't hesitate to hit the like button, subscribe to the channel, and share it with your loved ones. And if you'd like more information about healthy aging, click on the video now appearing on the screen, or choose from one of our suggested videos. Each one is a step forward to better understanding your body, your aging journey, and how to live joyfully and healthily every single day. See you in the next video, where health is no longer a distant idea, but a journey you can truly take control of, one day at a time. Wishing you peace, strength, and lasting vitality.